The Gaza Strip stands on the brink of famine after 19 months of conflict, mass displacement, and a blockade that has halted nearly all humanitarian aid. The region, home to about 2.1 million people, has seen food, water, and medicine supplies cut off for over 70 days. This blockade has led to acute food shortages, with 93% of the population now experiencing hunger. 500,000 people, or 1 in 5, are at risk of starvation between May and September. Historically, Gaza has faced cycles of conflict and blockade since the early 2000s. However, the current crisis is unprecedented in scale and severity. The Integrated Food Security Phase Classification Initiative now classifies the entire population as suffering from acute food insecurity, with nearly 500,000 facing catastrophic hunger, the most severe level before famine is declared. Scientific assessments show that famine risk escalates when food supply is blocked, health systems collapse, and sanitation deteriorates. In Gaza, these three factors have converged. The health infrastructure, already strained by years of conflict, has been largely destroyed. Clean water is scarce, increasing the risk of disease and malnutrition. The United Nations estimates over 71,000 children and 17,000 mothers urgently need treatment for acute malnutrition, a sharp rise from the start of the year. Geopolitically, the blockade began after renewed hostilities in October 2023. Border crossings have remained closed for over 2 months, the longest in Gaza's history. This has prevented more than 116,000 metric tons of food aid from entering, enough to feed 1 million people for 4 months. Despite the food being pre-positioned in aid corridors, it remains inaccessible due to continued fighting and access restrictions. Socioeconomically, food prices have soared. The price of wheat flour in central and southern Gaza has increased by 3,000% since February. This inflation has put even basic staples beyond the reach of most families. Market shelves are empty, and what little food remains is unaffordable for the majority. The blockade has also caused mass displacement, with people moving within Gaza in search of food, shelter, and safety. Community coping mechanisms such as sharing resources have eroded under the pressure. Culturally, Gaza has a tradition of communal support and resilience in times of hardship. However, the scale of deprivation has strained these bonds. Civil unrest is rising as competition for scarce resources intensifies. Reports indicate at least 57 people have already died from starvation, a number expected to climb unless aid is allowed in. The risk of famine does not arrive suddenly. It is the result of blocked access to food, collapsed health systems, and the breakdown of social support. With aid waiting at the borders and urgent needs inside, the situation in Gaza is now a test of international response to humanitarian catastrophe.